people, it's Wonderful Wednesday. I'm April Roll, your ER doctor online and a member of RoDocs. Today's topic is actually inspired by something that I see in the ER, and I feel like a lot of people don't even know that it exists. So I want to talk about ectopic pregnancies. An ectopic pregnancy is basically a pregnancy that is located outside of the uterus or the womb, and therefore it is in an abnormal location. It's not in its normal space of growing where a pregnancy grows. So in an ectopic pregnancy, instead of the normal process of the ovary puts out an egg, the egg travels down the fallopian tube, and a sperm comes along and fertilizes it, and then the embryo implants on the lining of the uterus. Instead of that happening, the ovary puts out an egg, and somewhere along the way, when the sperm fertilizes it, it implants somewhere else. And the uterus really is the only place in the body that is designed to grow an embryo, grow a baby. So anywhere else in the body, it basically causes a problem. The most common place for an ectopic pregnancy is in the fallopian tube. And risk factors for developing an ectopic pregnancy include having a previous ectopic pregnancy, having a deformed fallopian tube either from infections or surgeries, having being on medications to try and get pregnant, and also smoking. So those 4 things put you at a higher risk of developing an ectopic pregnancy. So you may be thinking though, how would I even know if I could be having an ectopic pregnancy? First of all, you have to be pregnant, obviously, and also it is earlier on in the pregnancy. The symptoms would include, in a milder case, lower abdominal pain and cramping, and maybe some spotting or even bleeding or heavy bleeding. But in a severe case, in an instance where the pregnancy got a little bit larger, you could have severe lower abdominal pain, heavy bleeding, and even dizziness, weakness, feeling lightheaded, becoming pale, even passing out. And that would be the most severe case where basically the pregnancy grows, it grows inside the fallopian tube where it is not equipped to house a growing embryo, growing baby, and the fallopian tube bursts. And that is what we call a ruptured ectopic pregnancy, and that is a surgical emergency. So on to the treatment of an ectopic pregnancy. So let me just talk about ruptured ectopic pregnancy first, since I did just mention that. That is a surgical emergency. The woman would go to the operating room, and the OBGYN would basically surgically remove the pregnancy and repair whatever is going on with the fallopian tube. Now, like I said, the fallopian tube is the most common place, but it could happen on the cervix, it can happen outside of the reproductive organs themselves, but basically anywhere that other than the lining of the uterus, the ectopic pregnancy would have to be removed. Now, if it has not gotten to that point, because it's earlier on and it's of a small size, the treatment would be to receive medications that would dissolve the pregnancy. So unfortunately, whether you're falling into the smaller ectopic pregnancy, which is earlier on, or the larger pregnancy, which causes rupture ectopic, and I'm not talking about, like, the person's like 4 months pregnant. This is early in the pregnancy. But either way, whether it's mild or severe, the pregnancy is essentially terminated because the embryo and the pregnancy, whichever stage it's at, it is not viable, and it is a basically like a ticking time bomb for the mom, because if it does continue to grow, this is a condition where, if left unchecked, what is going to happen is the fallopian tube will rupture, or whatever organ, wherever the pregnancy has implanted itself onto, because it's not equipped to grow a baby, it will cause some internal bleeding, some pain, some complications, and it would turn into a surgical emergency. And a rupture ectopic that's left untreated, unmanaged, would lead to bleeding out internally and lead to death. So that's just something that I kind of wanted to talk about to everyone, because I'm not sure that everybody knows about ectopic pregnancies. When it comes to pregnancies, people do understand complications of miscarriage. They understand preterm labor. They understand some infections and some common conditions that can happen in pregnancy. But I feel like a lot of people do not know what an ectopic pregnancy, also known as a tubal pregnancy, if obviously if it's in the fallopian tube. So I wanted to come on here and just talk about that on this Wednesday. So I want to thank you guys for sharing this wonderful Wednesday with me. If you thought this video was helpful, or you learned something that you didn't know, please share so that others can learn from this as well, and spread this to their family members so that people can be aware of this condition. If you have any topics that you want me to talk about on this wonderful Wednesday, another wonderful Wednesday, please leave that in the comment section below. If you want to schedule a telemedicine visit with me, then please visit rodox.com/Dr. April Roll. That link is in the description box. So check that out if you do want to schedule a telemedicine visit with me. So again, thank you for sharing this wonderful Wednesday with me. Be blessed and stay healthy.